evening and welcome to Trending Tonight, the only show on primetime Indian television where we care to explain the news behind the trend. And trust me, you must make sure that this subject that we are going to focus on, trends not just on social media but on your minds right now. Ladies and gentlemen, farm fires are back. I'm not talking about the farm reform bills. We are talking about the actual stubble burning. And this time around, there is a double whammy. Why do we call this a double whammy? Because on one hand, you've got stubble burning, which will lead to pollution. On the other hand, all of this is happening in the midst of a pandemic, which means that a virus that will weaken your respiratory system will further wreak havoc when there is extra dose of pollution, which Delhi or the northern parts of this country in any case witnesses. So what should our strategy be? Have we wasted a lot of precious time? And thus we are in a situation where the same old problem with double the intensity is going to hit us really hard come this winter season. I want to welcome all the guests as we play out these pictures on your screen right now of the first images that have now emerged from Haryana as well as Punjab of the stubble burning that is taking place. Mr. Hardeep Kangra, ex-Vice Chairman of the National Environment Appraisal Committee is now with us. We also have Dr. Sunita Narayan, good to have you on the show, Director of Center for Science and Environment. We have Professor Dr. Anita Ramesh, Senior Consultant, Medical and Pediatric Oncology of the Apollo Hospital, and Dr. Rakesh Verma, Additional Director General of Health Services of the Government of India. This is an extremely important discussion and we have to fix even now what we can. A stitch in time always saves nine. Can we? Or perhaps this is like a lost cause. Let's put that to debate. Dr. Sunita Narayan, let me begin with you. The same problem, many solutions have been spoken about year after year. This has almost become a season where all of us get together, talk about these things, propose solutions, and then we've got the same problems highlighted by the political class. Do you think this time around there can be no scope for any such discussion, because we are dealing with not just stubble burning but stubble burning in the time of a pandemic? Dr. Narayan.
No, I think it's a very worrying question, Sanket, and I think this really concerns us because it's a double whammy. I mean, the fact is that the pandemic, COVID-19, is about affecting our lungs. And if you have high levels of pollution, you have very, very dangerous issues of comorbidity. So air pollution becomes an even more serious concern in the time of the pandemic. But you're also absolutely right that the bandwidth with governments to deal with anything but the crisis, the health crisis that they have, is so little. I mean, there are solutions. There is a lot of work that governments are aiming to do. The Supreme Court has directed action. Last year, a plan was made. Money has been sanctioned. Machineries are being bought by the state government. But you know, all this requires a certain amount of time, attention, and an ability to be able to drive action. And when governments are so stressed, it is tough. But I think this is the point of concern. We cannot afford air pollution at a time of the pandemic. We just cannot afford it.
Okay. Hardeep Kangra, you're also the Chief Media Panelist and Spokesperson of the Punjab Congress. You represent the Punjab government's version. I want to ask you, Mr. Kangra, don't you think that the Punjab government, for the past 3 years at least, I have seen statements from Captain Amrinder Singh, we'll talk about these past 3 years, where you've always blamed the centre, that help in assistance packages so that we can help the farmer. The cost to making sure that the air remains clean must not be borne by the farmer. I agree. And chalaning the farmer is something that you don't want to do. You don't want to penalize the farmer for stubble burning. But then in these 3 years, surely the Punjab government could have gone beyond just asking the centre to treat this as a problem. What has the government done so far? This time around, it will be a double whammy for your government as well.
Yes, true it is that in the pandemic scenario, with the more pollution in air, the people will have bigger problems. But now I will speak on, wearing two hats. One is the Congress spokesperson or the chief media panelist, and second is an environmentalist. There is no human activity which does not pollute, be it industry, be it motor vehicles, be it agriculture. This is the cost of food production. And this food production cost is there to damage the environment also. But the question is there any remedy to it? Is there any alternative to it? No, yes, there is an alternative. But that alternative costs something. And that cost, who will bear that cost? The cost is not of the machinery only where the government of India has subsidized. The cost will be running that machinery also. The cost will be the personal input which the farmer is going to put into that cost. The agriculture as such is not a economically viable activity. The entire country is crying over this, that whatever we are getting is not the correct thing from the agriculture. It is not viable. So any additional burden on the agricultural economy or the economics of the crops will certainly put the farmer again into a debt. So the question is 50% subsidy or 80% subsidy to the institutions which Government of India has sanctioned. Of course, the Punjab government is getting 300 crore this year and will be buying 23,000 machines. But will the machines run on their own? Will the running cost will not be there for the machines? Is 50% is the only cost? Balance 50% doesn't have any cost of money. Is that money available freely to the farmer? These are the questions which the government must answer. And secondly, if the Government of India this time of pandemic is cutting the salary of the member of parliament, freezing the dearness allowance of their government servants, how the state government will meet this expense? Because state governments are already having a resource crunch. Their sources of income has gone down. The GST payment is not being made by the...
Question. Mr. Hardeep, very quickly, see, my point is there will be more than enough and plenty of opportunities for you pointing fingers at the center and they pointing fingers towards you, right? We have seen that happen over and over again. My point is, in just a few months from now, the stubble burning is going to explode as a situation, and pardon me for saying this, your explanation as of this moment seems a little too simplistic, that there is a cost to food production. Yes, of course there is. But, had good practices been followed, and I'm not just blaming you, but a coordination problem, then we could have stopped this. See, the reason why I ask you this question is because there are study after study that show that air pollution can turn mild COVID infections into acute cases. There's a US study which says that air pollution increases susceptibility to tuberculosis and SARS. The study also goes on to say that air pollution is linked to conditions such as diabetes and cardiovascular disease, which means that in a situation right now, and I want to bring in Dr. Anita Ramesh. Dr. Ramesh, in a situation like now, where you have a lot of people who can sustain, whose bodies can sustain the COVID-19 pandemic, will not be able to when suddenly there is a pollution surge.
Yes, a very good evening to everybody. Yes, I agree with you. Now, what is the thing is that when, see, we are living in a country, or not only we, the whole world, there is huge amount of pollution. And every day the burning of the fossil produces large number of nitrogen oxide. And there's something called PM 2.2. And that is the one which is very, these small particles, once it enters into our respiratory system, it gets into through the trachea, tracheoles, bronchi, bronchioles and alveoli and causes the damage. And this particle, once it gets into, and you are already exposed to a polluted air, and on top of that, the COVID infection takes place. Now remember, the SARS-CoV-2 virus is basically affecting the respiratory tract. It affects the upper respiratory tract, gets into the lungs, and if your lung is already being damaged because of pollution or because of any other thing, so it's very easy to the virus to creep into it, and they produce the inflammatory reaction, they cause damage, and then all the symptoms of COVID takes place. So to sum up in one word, yes, the pollution has damaged all our lungs. If you see the epicenter all over the world, for example, Manhattan, or the big cities like Chennai, Delhi, where the COVID affection is high, many people are on ventilator. Okay, this is because the air is polluted and the infection rate is high. But one thing good about India, we have done well compared to the other countries. Our recovery rate is high, and we don't know what's the reason is, but definitely polluted air is adding to the morbidity and mortality of the COVID infection.
Absolutely, and exactly around this time, when we are adding close to 1 lakh cases per day, and that's also a different story, that we are testing less, so these cases are limited, and actually the cases, the active cases may be way higher than what we are reporting. Dr. Verma, if you look at the pollution levels as of this moment in North India, they are in the range of 150, 160, right? There is a typical problem with North India in the winter months, where suddenly pollution levels go beyond 999, and I don't know how high they go. And coupled with COVID, I want to ask from you that what really is the government strategy beyond sending a tweet, like the Ministry of Health just tweeted saying quit smoking for good, because people who consume tobacco or smoke are more susceptible to COVID-19. With air pollution of that level, your lungs are in any case going to be weak.
Sanket, let me confine myself to the medical part. Fine. So far as medical part is concerned, the previous epidemic that was seen was in 2003, when the SARS epidemic was seen, and was seen in the parts of Singapore and China. Those cities, those areas which were highly polluted, the COVID, that SARS deaths and mortality were very, very high compared to the area which had lesser pollution. In the current epidemic also, the most polluted part of the Europe is North Italy. In the North Italy, the death rate is maximum as compared to any other part of the Europe, because those are the areas were maximum polluted. And because the cities which were having higher degree of pollution, the transmission of the COVID was much faster, mortality is much higher, and there were outbreaks which were out of proportion to the same country or the same region. Fortunately or incidentally or luckily, in India, despite that heavy pollution, we did not see that heavy degree of outbreaks. And any degree of pollution will compound more pressure, more exertion on the respiratory system, because of the particulate matter which go through the aerosol or directly into the lungs, cause a lot of damage. They start a new inflammatory process, and the small arterioles get swollen up, and there is hardly any space for the air to pass and oxygen to transmit. They induce oxidative mechanisms which cause another trigger response. And sometimes there is the aerosol. While I am talking to you through the screen, you are being protected, I am being protected. But the small particles can remain hanging in the air for more than an hour, and they can cause more pollution. And if the air is already very heavy with the pollutants, so the COVID virus will remain in the air for much, much longer time, and that may increase the incidence, may increase the mortality, and increase the number of admissions to the hospital. So unfortunately, this is a
huge problem.
I fully agree on a medical aspect that pollution will bring more hazardous picture for COVID-19. As a medical man, I reassert that whenever we are going
this is extremely scary, because as a representative from the government of India, if you do admit that this is a problem, let us now use the remainder of the time that we have to look for solutions. Dr. Verma, let me begin with you. What do you think is going to save us? What do you think is going to save us in these winter pollution months? Mask?
I am an expert for the medical part, not for the pollution part. So for the medical part is concerned, through your media, I must tell you, this fight is not of a government. This fight is of each individual, each city in this country has got. And that fight cannot be fought by any state government, city government or national government unless I and you and each citizen cooperates in that. That is, first aspect is don't get out of the house unless it's mandatory. Only today, the London government of UK has extended the ban for 6 more months despite all resources at their disposal.
Correct.
So we must remember that we don't go out of the house unless it's mandatory, unless it's unavoidable. If I go to the house,
what you're saying, Dr. Verma, you're saying that right now you're appealing that people don't go. I want to ask you a simple question. The UK government had to come in and impose these restrictions. Do you think that the Indian government also, given that we have a massive problem of population, given the fact that we know that pollution is going to compound our COVID-19 trouble, do you think a government intervention is required, Dr. Verma?
Sanket, again I'll tell you, I am confining myself to medical problem. So far policies of government and government is concerned, I am not the right person to ask.
Question
No. I am asking medical questions. I will be very happy to answer.
From a health point of view.
So far as the policy and outcome is beyond my domain. So I will confine myself to medical aspect. And so far as medical aspect is concerned, I am here to answer all the queries. So for policy decision and other things that is the highest.
Sure. Dr. Anita Ramesh, let me now come to you. I'll come back to you, Dr. Verma. I'll come back to you. Let me get in solutions. Let's spend the rest of the time. So you've got to protect ourselves. Winter months are approaching and we have to protect ourselves. When we have acknowledged, when representatives from the government themselves, very honestly, and I appreciate Dr. Verma, with all honesty, you do admit that this is a huge challenge. I want to ask Dr. Anita Ramesh, what can save us? For those who are vulnerable, what can save us? What should we do in the next 3-4 months? The short-term solution.
Correct. Yeah, I think it's a very pertinent question of today's evening. Now we have to learn to live with virus. We have to learn to live with the pollution. We cannot come out of it. It's become a part of our life. So how do we go about? One is that we will try and see any measures that is causing excessive pollution, like burning of tires or anything which adds more of nitrogen dioxide, should be avoided and curbed completely from henceforth. Next, avoid cigarette smoking for everybody. As an individual, yes, masks is very, very important to completely wear the masks whenever you are going out, and also to practice breathing exercises which increase more oxygenation down to the alveoli, which will help you to fight the disease. To have immune boosting of yourselves, like what they say, vitamin C, vitamin D and zinc helps you to improve your breathing, improve your immunity in the body. And apart from, one more important aspect I wanted to say, the studies have shown that when we did the lockdown, the nitrogen oxide content of the atmosphere had drastically come down during the lockdown period. So, but we cannot keep ourselves locked down completely because economy is badly affected. But then we need to learn to live with the virus, with the pollution. And carry on with life. Self-protection is nobody is going to protect you. You have to protect yourself.
Dr. Sunita Narayan, you heard what Dr. Anita Ramesh said, and this is a fact. This is a fact that when lockdown was imposed, it did cost us a lot in terms of our economy, but on the pollution level, we did really well. Now, obviously, that is understandable. This is going to happen. Can you or do you think that for these winter months, a sort of a partial lockdown or a mechanism where we can curb the supply of pollution into the air, that must be exercised by the government?
Sanket, this is not new.
We know that this is a problematic time.
Yeah, I think every time you do these programs, every time we begin the winter season, it feels as if pollution is going to happen for the first time. Let's be clear. Each year, winter, it happens because it's inversion. We have pollution through the year. Why do we feel it more in winter? Because with the inversion, with the slowing of the wind speeds, with increased moisture in the air, the impact of pollution goes up. You already have fires in Punjab, but you don't feel the impact today in Delhi because the wind is dispersing the pollution. It will not do so as winter steps in by mid-October. Now, the fact of the matter is, yes, we did see better air when the lockdown happened. And yes, we cannot have another lockdown because it hurts the economy. But the fact is, we have a plan to deal with pollution. There is a plan and we need to act on it. So I think as media, as anchors, as informed people and as the public, we have to keep harping on and demanding that action must happen. And it cannot happen only in the 2 months when we cannot breathe. Action has to happen through the year because that's what pollution combating will mean. So let me just tell you what are the key things that need to be done right away. One, you need to make sure that there is enforcement in Punjab and Haryana. I do not agree with the fact that farmers are badly hit, and I agree with the fact that farmers have no alternative sometimes to burn. But today, with the machinery, with the money that is being supplied, farmers are being given an alternative. To give farmers money not to burn is a bad idea, because you will then create a perverse incentive. But what governments in Punjab and in Haryana are doing is to create ex situ, which means value for the stubble, so that farmers can sell the stubble for fuel generation, for power plants. That's what needs to be promoted. Too late to do it for this year, but that's what we need to focus on. As far as Delhi is concerned, as far as NCR is concerned, North India is concerned, we need to get rid of coal. So, Sanket, I'm sorry, I'm sounding a bit irritated, because I find these discussions deteriorate down to the inane. And we need to make sure that we have a very serious problem of pollution, and we have a problem of pollution with COVID. And as Dr. Verma very clearly and very rightly put it, it is going to be much more serious, because COVID affects the lungs. And so we have to do something about pollution.
True. Absolutely. Absolutely. All right, that's all the time I have in this discussion, but thank you so much. This is important, and through these winter months, we'll make sure that we get more programs. Yes, this is a discussion that happens on the media largely during the winter months when pollution sets in. But the point is, whenever we can put the spotlight on this problem, we must. This time around, it is particularly difficult, or it's going to be particularly difficult. There's pollution, and there's also that virus, which is out there, strong and invisible. That's a wrap in this edition of Trending Tonight. News continues on the other side.